Thank you, Madam Chair, Speaker. Sorry, I can tell you how this goes. I've lived this. I've lived in Canada for 3 years. I lived in Germany for a couple years. Single-payer health care does not work. I don't know why we want a monopoly. We're against monopolies, and then all of a sudden a monopoly that's run by the government is all of a sudden a good idea. Yet we criticize the post office, we criticize TSA, criticize everything. There's nothing the government does well. And then we want to give it health care, and we figure that that's going to be the fix. If you want to know why, if you want to lower costs, if you actually want to lower costs, look at something to lower costs. But this is a panel, an advisory panel, to find that suddenly, miraculously, that it can lower health care costs. So based on 100 people, a study that's based on 100 people, can. Of course it can. If you control it that much, it can. So let's see, I lived in Canada, so let me tell you a little bit about living in Canada. Canada, waiting list. Politicians would put themselves on 3 or 4 different waiting lists because they had access. Every now and then they would get caught. Of course, that's probably more of a political wrangling than anything else because they all did it if they needed a procedure. Multiple provinces all over the place. In Moose Jaw, Saskatchewan, where I lived, there was, that is an actual town. We came across a building when we were out walking around one day, and it was completely boarded up, and we couldn't figure out what it was. And it took a while, and it looked like a high school. It looked like a high school or something, and couldn't figure out why they boarded up their high school. It was an oil town previously. You thought maybe it had just gone out of business. We found out later that it was a tri-province cardiac care unit. So when they rushed in and they did all of the single-payer health care and rushed everybody through and took care of everybody's Band-Aids, and everybody thought single-payer health care was great, they made a tri-county cardiac unit, so everybody from 3 provinces, which are pretty large, would have to go to this cardiac care unit to get care. Well, then when that doesn't work, guess what they do? They just close it up, board it up, take everything down. You would never know it existed. Waiting lists. My wife was scheduled for a procedure on the 5th of November, and then we were elated when it got moved up to May. So we waited around all day and then found out after you have to pay to turn on the TV, pay to turn on the phone, pay to get clean sheet, everything. That the stuff that we take for granted here in the United States. And then find out halfway through the night that they had transposed 511 to 11.5 and couldn't get her in. Now, there are plenty of there were plenty of operating theaters that were open. They just didn't have the doctors to fill them. They didn't have the staff because they had cut back. Because once this happens, every single patient is a liability to the government. And it's always interesting when you say, let's do single-payer health care, and then you do Medicare. Well, now the people that are paying the Medicare have a vested interest in you dying. And it's not a matter of just having death panels or life panels. Rahm Emanuel himself suggested that adding a multiplier at the age of 75. Now, he didn't delineate it, but the easy way to do it would be to take your age, take 75 minus your age. So if you're 75 in a day, because this was the example that he used, 75 in a day, you would have, say, a -1 multiplier. And then you take that -1 and you multiply it by something cheap, like an antibiotic for a urinary infection. And now, that $5 medicine is a negative value to the government. And his suggestion was, well, at that point, it's just better to let the people die. So that's what you get when you get single-payer health care. So when we were in Canada, we had, for everybody who's worried about maternal health, everybody had to go to Regina from Saskatchewan to get an ultrasound. You think the OB would have one in the office? Nope. You sign up for a procedure and you go and you wait with hundreds of other people for the ultrasound in a single payer provided location, hour and a half away. That's single payer health care. That's efficient because everybody is a liability in that system. When we lived in Germany, my wife was thrilled because we got an appointment at 0800, and then so that's going to be for a doctor that was about an hour away. And that's fantastic because then you're going to be seen first, you think. Well, you know what? You show up at 0800 with about 300 other people that are all waiting for an appointment that day. And it's first come, first serve. That's single payer health care. Because you have a monopoly. When we lived in New Mexico, we had a lot of friends who were Germans because my kids went to the German school, and we coached the German soccer team for the little kids. So friends, his brother would leave Germany after he had done his requisite number of hip surgeries, because once he's done the requisite number of hip surgeries, there was absolutely no point in doing any more because he was not going to get any more money. It's only liability at that point. It's only risk, no reward. So what he would do is he would fly to England because they also have a single payer healthcare system, and he would do surgeries there on the economy because they would not do a hip replacement after age 67 because you're not really a useful member of society anymore, and it's probably best you just shuffle on out the door. That's single payer healthcare. Does it save money? Yeah, it saves money by killing people. That's how it saves money. That's how socialism saves money. Purpose of socialism is communism. The purpose of communism is hell. Read Marx. Blood work, 2 weeks, if it doesn't get lost. I have a grandson that's due on the 5th of November. I had a daughter that was due on the 5th of November, but you know what? The blood work for progesterone got lost because it had to be shipped away to an hour away, and the progesterone needed to be done that day. So when we finally got the results 2 weeks later, and my wife got a call and said, "Get in here right away because you need this," it was too late. And that's what the surgery was for. Single payer health care. It's a government monopoly by a bureaucracy that does nothing well except kill people. So to pretend you're going to have a bill and foist it on Colorado and say, "Oh, look, we found that single-payer health care system can save money." It will cost lives. But again, that's the purpose. I have lived in this system. I have friends who have lived in this system. They would, just like my colleague said, they would come to the United States. They would travel to the United States just for health care, just to beat the system. A friend of mine, we were at a picnic, and he said his daughter fell one day down the stairs. Took her to the ER because her eyes were crossed. Her eye was crossed. They said, "This is indicative of a brain tumor." And they rushed her to the top of the line for a CAT scan or MRI or whatever you do. And he was quite happy about that because it only took 2 weeks.
Representative DeGraff, you have 1 minute remaining.
So 2 weeks for a CAT scan because his daughter might have a rapidly growing brain tumor. That's socialized medicine. That's a government monopoly. That is death to Colorado. Everybody likes to pretend that this thing works. It doesn't work. You can go to study after study. Talk to the people who live it. Talk to the people who want to get out from under it. Talk to the doctors that were there, and they were mostly South African. Now that was different. That was like Ron Weinberg, South African, because they all spoke Dutch, Afrikaans, and they were thrilled that De Graaf, and I couldn't pronounce it right. But they were all there waiting so they could have enough hours so that they could get into the United States. When we've lived in other states, when we've lived through the states, we have TRICARE. TRICARE is pretty good, but it's basically like
Representative
Medicare.
DeGraff, your 10 minutes have expired. Thank you.
Not as many as will.
Representative
expire.
Frizzell.